Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, what are the drugs causing neuroleptic malignant syndrome? If you see the drugs causing neuroleptic malignant syndrome, it is caused by postsynaptic D2 receptor blockade. Will result in neuroleptic malignant syndrome. So these includes domperidone, haloperidol, haloperidol, and metoclopramide. So it has high D2 blocker, whereas haloperidol is high D2 blocker, whereas metoclopramide and domperidone are actually gastrokinetic agents with D2 blockade. And if you see domperidone, it has restricted entry across blood-brain barrier. Thank you for watching.
Thank you and thank you for watching.